What are the negative side effects of Suboxone? Suboxone is a medication used for treating opioid addiction. While Suboxone can be very safe and effective in treating opioid addiction, it can also cause negative side effects to a patient undergoing treatment. If you are thinking about taking Suboxone, you must know about the positive and negative effects of the medication. This video will discuss many of the side effects of Suboxone and how it might affect your life during and after Suboxone treatment. We hope this information will help you make an informed decision about whether or not Suboxone is right for you. Opioid use disorder, or OUD, is characterized by the frequent and uncontrolled use of opioid drugs. Common opioid drugs include heroin, oxycodone, and fentanyl. While opioid medications can provide pain relief, they also carry a high risk of addiction and overdose. Suboxone is a medication for OUD. It has two active ingredients, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist that binds to the same receptors in the brain as other opioids. It prevents withdrawal symptoms and cravings for opioids. On the other hand, naloxone is an opioid antagonist that helps prevent abuse. These two ingredients work together to ensure that Suboxone is a reliable and safe treatment for opioid addiction. In fact, the FDA has approved Suboxone as a treatment for addiction to opioids such as heroin, oxycodone, fentanyl, and more. Suboxone is a Schedule III controlled substance, meaning it has accepted medical use in the United States but also has the potential for abuse and dependence. Schedule III drugs are considered to have a lower potential for abuse than Schedule I or II drugs, but they still carry a risk of dependence. Suboxone is generally safe and effective when used as directed. However, it can still be abused if people take higher doses than prescribed or more often than directed. Suboxone is used to treat opioid addiction and dependence and works by binding to the same receptors in the brain as opioids. However, because it is a partial agonist, it produces a much weaker response than full agonists like heroin or oxycodone. Suboxone is mainly used for treating patients who are suffering from OUD. It is used as part of a comprehensive treatment program called medication-assisted treatment, or MAT, that involves behavioral therapy and counseling. This type of treatment ensures the best chances of success for people trying to overcome opioid addiction. In most cases, though, Suboxone is taken as part of a tapering schedule, which means that the dose gradually decreases until the patient is no longer taking the medication. It helps prevent withdrawal symptoms and allows the patient to adjust slowly to life without opioids. Suboxone is also used as an off-label treatment for other conditions, such as chronic pain and depression. However, the FDA has not approved Suboxone for this purpose. So if you are considering taking Suboxone for anything other than opioid addiction, be sure to speak with your doctor first to discuss the risks and benefits. And regarding risks and benefits, Suboxone has a few potential side effects. While Suboxone is widely considered an effective treatment for opioid dependence, it still has side effects. The most common side effects of Suboxone include: this is by far the most common side effect of Suboxone. It is caused by the partial opioid agonist properties of buprenorphine, which slows down gastrointestinal motility. To combat constipation, drink plenty of fluids and eat a high-fiber diet. You may also ask your doctor about taking a stool softener or laxative. These side effects are common and usually mild. The aches typically go away on their own within a few days. You must talk to your Suboxone doctor. Talk to your Suboxone doctor if the pain becomes severe or does not go away. Weight gain or loss has been reported with Suboxone use. However, it is unclear if Suboxone causes weight changes or is due to other factors, such as changes in diet, activity level, or the individual's overall lifestyle. Talk to your doctor if you are concerned about your weight. Having rashes is not a common side effect of Suboxone use, but you might experience it if you have allergic reactions to the medication. Immediately stop taking Suboxone and call your Suboxone doctor if you develop a rash. About 14% of patients reported that they experience excessive sweating as a side effect of Suboxone. This side effect is usually not severe and goes away within a few days. Withdrawal from opioids can cause insomnia because of the uneasiness of not having the drug in your system. Suboxone can also cause insomnia because of its opioid partial agonist properties. Talk to your Suboxone doctor if you have had trouble sleeping for more than 2 weeks. Diarrhea is when you have watery, loose stools more than 3 times a day. It is a common side effect of Suboxone as you change your diet during recovery. If you experience diarrhea, be sure to drink plenty of fluids. Other side effects of Suboxone include nausea and vomiting, dizziness, painful tongue, mouth numbness or redness, irregular heartbeat, weakness or fatigue, lack of focus. Talk to your Suboxone doctor if you experience any of these side effects. They may be able to adjust your dose or prescribe a different medication to help you manage your side effects. Aside from the ones mentioned above, Suboxone can also cause serious side effects, including anaphylaxis is an intense, life-threatening allergic reaction. If you have trouble breathing or your throat closes up while taking Suboxone, call 911 and get to the hospital immediately. Suboxone is a Schedule III controlled substance because it has a potential for abuse and addiction. However, the risk of abuse and dependence is lower with Suboxone than other opioids because of its partial opioid agonist properties. But misusing this drug can lead to dependence and addiction. If you are not careful and do not follow your doctor's instructions, you could abuse Suboxone. Suboxone can cause respiratory depression, which means that it slows down your breathing. Call your Suboxone doctor if you experience shallow breathing or have difficulty breathing while taking Suboxone. In rare cases, Suboxone can also cause coma. Suboxone can disrupt the normal production of hormones in your body. It can cause problems with your menstrual cycle, sex drive, and fertility. If you experience any of these side effects, talk to your doctor. Suboxone can potentially cause liver damage if you have any conditions that put you at risk for liver disease. If you have a history of liver disease or any other medical condition, you must disclose this to your doctor before taking Suboxone. In the initial stages of Suboxone treatment, you may experience severe withdrawal symptoms as your body adjusts to the medication. These symptoms can include nausea, vomiting, diarrhea, sweating, and shaking. It is an uncomfortable process, but it is crucial to stick with it and not give up. The withdrawal symptoms will eventually disappear and you will start feeling better. But if you experience these symptoms in a severe or life-threatening way, call your doctor immediately. Remember that Suboxone can also cause mental and psychological side effects, including depression, anxiety, stress, and irritability. If you experience any of these side effects, talk to your doctor so they can help you manage them. You may have worried after watching about all the potential side effects of Suboxone. However, these side effects are usually mild and go away as you continue taking the medication. The recovery process is rough, but with the proper treatment and support system in place, you can get through it. If you are struggling with an addiction to opioids, Suboxone can be the life-changing tool you need to get back on track. Find a Suboxone doctor near you today at suboxonedoctor.com.